Did Jeff yell at me?
This is sort of the common open.
No, I think that's
The subcommittee hearing will reconvene, and we go to the Republican side. Mr. Murphy of Pennsylvania.
Thank you, Mr. Chairman. Mr. Chairman, I also ask that my testimony can be submitted for the record on this, and I thank...
Without objection, so ordered.
Thank you. I thank our panelists here. I have a couple of questions on your testimony, and thank you for that. One has to do with, Dr. Dietz, in your testimony, you talk about perinatal problems, infant mortality rates, et cetera, with this. Is this something that, given that, and also the comments you make later on about, or you made in other parts of your testimony about the increased cost of health care with obesity, are you aware of any studies done or studies that are planned on such issues as, for example, looking at our infant mortality rates and factoring in the issue of obesity as something that we should be paying attention to?
No, we've not done that. And the issue that I'm most aware of is less about infant mortality than infant morbidity. Mm-hmm. That we know that excessive weight gain during pregnancy, tobacco use during pregnancy, and diabetes during pregnancy predispose to big babies, so that there is likely there's likely an increased frequency of complications during delivery. There is early onset of obesity in children who are exposed in utero to those factors.
Well, given that, the other question I have for both you and Dr. Huang has to do with some insurance plans, some health insurance plans actually offer differences in premium and copays if people keep their weight within certain ranges and see their physicians, et cetera. Are you aware if there was any studies that talk about, either of you aware if there's any studies that talk about when those incentives are offered, changes in premiums or copays, based upon a person's weight within a certain range, if it makes a difference then in their health and their morbidity rates and, of course, ultimately also in their health costs? Dr. Dietz.
I have some nagging thoughts that, yes, there are such data, but I can't call them.
Is that something you could get for us? I think would be valuable. Dr. Huang, do you have any knowledge of any studies in these areas?
To my knowledge, NIH hasn't funded any studies with regard to that specifically, but perhaps our colleagues at AHRQ might have more data.
Well, you can imagine how valuable that would be to this committee to know that information. So I appreciate that. And the other area I wanted to ask about, because so much of the testimony that we've heard also talks about nutrition, and of course, we hope people eat healthy, and we talk about such things as activity, and we hope they take advantage of activities, but we haven't talked about a requirement for activity. I'm fascinated by some work that's been done in the Naperville School District. I don't know if you're aware of that, but they actually require an hour of activity every day. I think Illinois is the only state that requires a phys ed class. The rest of states have dropped that. And many times states say we don't have the time to do this because we have to spend more time with math and reading, et cetera, to get academic scores up. I found it interesting. They said that 97% of freshmen are at a healthy weight compared to the other things we see about young children. Students wear heart monitors during their gym class to make sure they stay at target heart rates. They're allowed a wide range of activities. It isn't just, a dodgeball with the big kids and where they can stand at their side. And also, they perform in the top 10% in the world on standardized math and science tests. A fascinating link there. Wondered if you two can comment on other studies we might learn from or jump into the next level. Should we require students to take gym class or at least educate our school system around the country about the value of that? Dr. Dietz.
Well, there are two very important benefits of physical activity and obesity prevention and control. One of the benefits is that physical activity reduces the risk of comorbidities, so that if you're overweight, have elevated blood pressure, and are inactive and become active, your blood pressure will improve. Similarly for lipids, similarly for glucose tolerance. When one begins to talk about health at any weight, which is an important concept because not everybody can lose weight, physical activity is one of those important strategies. The second benefit is the one you alluded to. We published a study 2 years ago showing that physical activity improved test performance in younger children. And anecdotally, at least, teachers say that physical activity also improves behavior. So the irony is that at a time when schools are investing or divesting themselves of physical education programs because of the No Child Left Behind program, they may be throwing out one of the most important programs to improve test scores. The third comment is that in Pinellas County in Florida, they've developed an integrated program that focuses on physical activity both in child care and in elementary schools. Whether it's going to have the same results as those in Naperville remains uncertain, because Naperville has just an extraordinary program, as you correctly point out.
Dr. Wang, any comments on that?
I concur with Dr. Dietz's comment. There is definitely research linking physical fitness with better academic outcomes. So I'm in concurrence with that.
Well, I hope that's another area you can get to the chairman so he can distribute to the committee. It's very valuable to us to do that, because it's not one of those things that costs a lot to keep kids active, and the outcome in grades is huge. And I hope more schools pay attention to this. Just in your comments today, I hope that word gets out.
Certain you're asking about the study showing
the studies, if you're aware of some other studies that talk about basically overweight, underactive, underachievers versus getting kids up involved again. Thank you very much. I yield back, Mr. Chairman.
Thank you. Next is the gentlewoman from Florida, Ms. Castor.
Thank you, Mr. Chairman. Dr. Huang, as both you and Dr. Dietz have testified, childhood obesity is an epidemic affecting all children, regardless of race or where they come from or their socioeconomic status. However, we can't ignore the fact that childhood obesity disproportionately impacts racial and ethnic minorities. I wonder, given that TV viewing paired with advertising is a major contributor to childhood obesity. I mean, there's still a breakfast cereal that's cookies, right? I'm curious if research has revealed that disparities in marketing of unhealthy foods to racial and ethnic minority children.
Yes, there is. I believe that there was just a press conference this past Monday by Children Now, releasing a couple of studies showing that there is disproportionate exposure among minority children to advertising for foods that may be nutrient poor but energy dense. The Institute of Medicine has also released reports in recent years indicating how exposure to advertising leads to or influences consumption of different kinds of foods. So I think that the research is pretty strong, indicating at least the link between food consumption, dietary behavior, and exposure to advertising. So I understand that right now there is an interagency group looking at these issues, and I believe that results from some of those dialogues should be forthcoming, and we look forward to looking at FTC statements on nutrition standards for advertising and collaborate with them in appropriate ways. And maybe Dr. Dietz has other comments with regard to CDC's involvement in that.
Yeah, Terry is absolutely correct that there are disparities, both in terms of the amount of television viewed, which tends to reflect the differential prevalence rates in children, as well as differences in the type of advertising that's directed towards minorities. Yesterday, we released a report, the FTC released a report that CDC, FDA, and USDA were part of, which began to set advertising standards for foods advertised to children in the media. Those were the product of a lot of hard work by this working group to base these standards in a very transparent way on prior recommendations, as well as what was optimal for the health of children. And we've asked industry to respond to those standards and let us know how those standards would affect their current products and those products advertised on children's television.
Are there any insidious ways, other than you know the research on prevalence of TV viewing and things like that, but have you come across those insidious marketing practices that are targeted specifically to minority children, or is it really across the board, and then the prevalence impacts the obesity rates?
I don't know the answer to that question.
Okay, I'll yield back, Mr. Chairman.
Thank you. Gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. Dr. Dietz, Dr. Huang, thank you for being with us today and testifying. I want to ask kind of almost a rhetorical question. We're going to be hearing from a second panel, and I guess there are 5 or so individuals on that panel. I've read most of the testimony. I know that and I'm looking forward to actually hearing from the American Academy of Pediatrics. And in that testimony, there was a recommendation for a real comprehensive approach toward solving this problem. In fact, they say a pediatrician is going to testify that to solve this problem, you need a medical home, you need a medical disciplinary care of pediatricians, subspecialists, surgeons, nurses, dietitians, mental health professionals, exercise specialists, school staff, social workers, and I'm not disagreeing necessarily with that, and I do think that this is a significant problem that we need to try to address in the most cost-efficient way. But when you get too comprehensive, of course, every one of these people have to be paid, and they're going to be expecting to be paid. But you know, we have a limited amount of money. We've been talking about that for the last almost year as we've debated this comprehensive health reform or health insurance reform plan and how to spend the dollars effectively. I don't know that there is a silver bullet, but if there's an arrow or two in the quiver that's sharper than the rest of the pack, I think we should use it. So my question is this. How important do you think the role of parental behavior is in regard to the problem of childhood obesity? Could you give it a percentage, or I know we're talking about genetics and environment and lack of ability for the children to exercise and too much television and et cetera, et cetera, et cetera. But of course they're eating at the same table for the most part with the parents. And there's a lot of learned behavior here. So comment on that, both of you, if you will.
That's a hard question to assign a percentage because there are, as you point out, genetic determinants or genetic susceptibility. But those genetic elements that increase susceptibility are acted upon by an environment, and certainly the first environment and one of the most important that young children live in is the home. And there's no question that parents can play a significant role in, and do play a significant role in, the types of foods their kids eat, the access or utilization of physical activity facilities, and screen time, all of which are significant risk factors. But in many cases, although we would like parents to make the right choices, they don't have the right choices to make. And that opens up a broader environmental issue.
Yes.
So that, for example, you can't very well expect an inner-city parent who lives in an unsafe neighborhood to let their child go out and play.
No.
You can't very well expect somebody to increase their fruit and vegetable intake if they don't have access to supermarkets or farmers markets that provide those. And frankly, I don't think we have a good way of accessing parents in a way that fosters behavior change. And
Dr. Dietz, I understand that. I don't mean to cut you off. I want to hear from Dr. Huang. I had one follow-up real quickly if I have time, but Dr. Huang won't.
Yeah, well, I think there's no question that parents play an important role. But as Dr. Dietz pointed out, parenting and parents' behavior do not occur in isolation. And so, you know, providing the environment, you know, that would be conducive to having parents engage in the behaviors that we want them to engage in, I think would be really critical. We've spent years doing research trying to tell parents to, you know, get their kids to eat better and get their kids to exercise. Even if we might be effective in changing some of those behaviors in the short term, we're not able to sustain those behaviors over the long term. And I think the precise reason is because behaviors occur in context.
Well, I want to thank you, and in the just few seconds I've got left, I would like to make this comment, Mr. Chairman. When we marked up H.R. 3200 then, which became 3962, our health care reform bill, there was an amendment made to suggest that employers should be able to incentivize their employees for healthy behavior, stop smoking, lose weight, exercise, and in return, a premium reduction, kind of a reward to get people to buy into that. And of course, the payback for the employer was better attendance, better workers, better skills, less accidents in the workplace, and apparently HIPAA limits the amount of reduction in premium to 20%. Now, in the bill, I think we did raise it to 30%, or maybe 50% even on the Senate side. But the Secretary of Health and Human Services would have to approve those type programs. And I know you don't have time to respond, but I think this is a good thing that we ought to continue to stress and push, because if these parents get healthy at work, they're going to come home and pass that on to their children. Mr. Chairman, thank you for your indulgence, and I yield back.
Thank you. Gentleman from Maryland, Mr. Sarbanes.
Thank you very much, Mr. Chairman. This is a very important hearing. This is one of the most important hearings I think we've had in this committee all year, because, and you've heard the discussion, so much of it is focused on our young people and developing in them the right kind of lifestyle habits so that they can improve their health over the course of their lives. I wanted to just mention a couple pieces of legislation that I've been involved with that I think are very much on the mark with some of the testimony we've heard today. The first is something called the No Child Left Inside Act. It's a little bit of a play on words with No Child Left Behind, but it's the idea of trying to promote more opportunities for environmental education and the integration of outdoor learning experiences and education into the overall instructional program across the country. It would encourage states to establish environmental literacy plans, which is sort of their vision for how to make sure when children graduate from high school, they've had some baseline exposure to the environment and have incorporated these experiences in. It's based on research, and we've heard some of this already today, but research that indicates that these days the average young person is spending 4 to 5 hours a day inside on video games, television, and the internet, and about 4 minutes a day in what we would say is outdoor, unstructured recreation. We've gone from a generation where your mother had to keep calling you in for dinner to where parents, albeit dependent on the particular environment or neighborhood they're in, are trying to push their kids more outside because they seem to be spending all their time on screen time. And we've got to get back to a balance. So that's one legislative vehicle to try to bring more attention to this need for a balance. The other is something called the Foundation for a Fit Nation. There's a council, the President's Council on Physical Fitness. It was established under President Eisenhower, and then President Kennedy expanded its charge that focuses on physical fitness and tries to keep that kind of high profile. But it is currently unable to raise private funds to support its mission. So this bill would actually create an opportunity for that to support its activities. I think it gets about $1.2 million a year now directly in appropriation, but could certainly do much more if it had support from the private sector. So all these things are designed to bring more attention to the issue that you're describing. I had two questions. One relates to each of those. We've heard about how this problem of obesity, and I want to focus particularly in on childhood obesity, can be affected by a combination of diet/nutrition, genetics to some degree, the environment, and then the amount of exercise. As you think about those components and maybe others, I mean, do you have a kind of, in your own mind, do you prioritize one over the other? Do you find them so inextricably linked to one another that it's unuseful to do that? Or would you say we can make huge strides at very little cost, arguably, if we just improve the kind of exercise component? So if you could speak to that, and then I have one other quick question.
I think both are equally important for different reasons. I think that dietary intake is critical in the prevention and even more important in the treatment of childhood obesity, reductions in dietary intake. But physical activity has an important role in reducing the morbidities associated with obesity, like elevated cholesterol or lipid levels, blood pressure, and glucose tolerance. So I don't think you can separate those. I think they're both essential and have different effects on obesity and its outcomes.
I would just add that I think it's important to note that the environment enables or constrains behavior, such as diet, such as physical activity. And we've done research for so many years now that are targeted solely at the individual level with very little promising and sustainable results. And so I think if we are truly going to make a dent on this problem at the population level, we really need to begin addressing the environment more aggressively.
I've got 8 seconds. I'll just close with a comment. Representative Gingrey talked about the importance of parental leadership in this effort. I think there's real opportunity for partnership between parents and schools to begin to emphasize this. And I remember a young man who I was on a field trip with some youngsters to sort of illustrate the importance of this No Child Left Inside effort. And he talked about how, because of some of the activities at school that they'd begun, where they would get out into nature and do these walks and so forth, he had convinced his parents on the weekends to go, every Saturday morning do a 2 or 3 hour walk with the family. And parents are often guided in their priorities for leisure time by what their children want, if not always. And so I think you can get this partnership working in a very productive fashion. I'll yield back my time.
Thank you. Gentleman from Illinois, Mr. Shimkus.
Thank you, Mr. Chairman. I apologize for not being here for opening statements, but I appreciate this panel, and I appreciate the second panel that I'll be in. So if this has been talked about, my first question would be, what role does genetics play in this whole debate?
It's a significant role that influences susceptibility, but I don't think that we can point to genetics as the factor which accounts for the
primary factor, but it could be contributing based upon
absolutely.
The family. Dr. Huang?
I agree. I think, the human genome hasn't changed over the last, 50 years, yet the obesity rate has skyrocketed.
Those folks who are predisposed based upon their genetic makeup probably have to put even a more focus on the basic issue. We try to. My frustration is I'm kind of like Dr. Gingrey, and I'm a family individual. I think parental involvement. And you know what these kids need is they need a good health instructor. They need good food in the schools, and they need a good gym teacher. That's what they need. And we can have all the dang federal programs we want. But the micromanagement at the level, that's why I appreciate what the NFL is doing. We have to educate these people. It's calories in, calories out. You don't gain weight if you burn more calories than you consume. Is that correct?
Yes.
Dr. Huang? That's true.
So it's an issue of educating people. I'm a Big Mac. I'm a #1 extra value meal Big Mac drive-through guy. Mm-hmm. Okay? I have my Hershey bar and my Diet Coke. This is for my mental health. But I'll also go down to the gym and work out as long as I can get to it for maybe an hour to 90 minutes. And I'll burn those calories. So I am concerned that as we pile upon big government to try to micromanage the roles of the family and the roles of primary education in this country, we ought to be incentivizing them to do the right thing and encouraging them. It's not rocket scientists. It's calories in, calories out. You burn more calories, you don't gain weight. If you're genetically predisposed, you have to work harder. If you're genetically predisposed to high cholesterol, you have to then focus more on diet. But don't make this any harder. Please don't have the federal government rules and regulations. Let's just empower the local communities to get into their local public school systems and say, please, diet, exercise, healthy foods. And I appreciate your time, and I yield back.
Thank you. Gentleman from Iowa, Mr. Braley. Your state's the only one that has a phys ed requirement, apparently.
We have a statewide requirement, Chairman.
Oh, you do?
Well, I want to talk about that because as I've been talking about health care for 3 years, I remind everybody that health care is not a disease treatment response. That if we gut funding for our physical education programs in our schools, and if we try to impose a 1950s era physical education curriculum on today's youth, we are going to be drastically failing our responsibility to them. Do you both agree with that?
Yes.
Because when I was growing up in the 60s, we ate sugar smacks, which had 56% sugar in them, sugar frosted flakes, sugar pops, super sugar crisp. And I remember looking around my classroom, and there may be 1 or 2 kids in a class of 30 during the baby boom era who were considered obese. So even, and I think that if you looked at caloric intake back then, we probably had a higher caloric intake per capita than students today do. But we also were getting more healthy food in some ways on a daily basis, and we spent all day outdoors. And yet the harsh reality is, as a parent who had kids growing up in the 90s, most parents are faced with very different choices than our parents did, where you had a mother, in many cases, living at home and monitoring the behavior of children, and children who were faced with much fewer threats out in the world that allowed them to spend all day outdoors the way we did as kids. So my question is, how do we get society to focus on the challenges of providing lifestyle physical education in our schools on a daily basis that gives them not just dodgeball skills, but things that teach them aerobic activities they can carry throughout their lives? And how do we provide the type of informed nutrition labeling at the point where they're consuming food in the schools, which is our best place to reach them outside the home, to give us a realistic chance of bending this curve of upward juvenile obesity downward? Dr. Huang?
Well, I agree with your points completely. And I think actually the points from the congressman from Illinois are consistent, with our messages today. Providing good gym teachers or providing good food in schools, those are part of the changes in the environment that we are talking about today to make it possible or easier for parents and kids, to engage in the right behaviors. With regard to your point specifically, I mean, we do have, I think, emerging trends, for example, in urban planning, creating more opportunities within urban environments for physical activity, whether it's just physical activity engaged going back and forth between public transportation and schools or work, or new building designs, like in New York City, for instance, putting in looking at design of staircases, looking at different building codes, having playgrounds nearby, new housing developments, et cetera. And we're going to hear more about activities with regard to reintroducing healthy food access to some of the neighborhoods around the country. So I think there are promising strategies that are consistent, with our modern life. But it's really important to know that we can't just keep telling children and parents that you have to eat better, you have to exercise. We got to create a larger context to make those behaviors possible.
Dr. Dietz, before I get to you, I want to frame this a little differently, because one of the things we know is kids do behave differently today. Many of them are focused on access to computer games, the internet, and they are stimulated differently than we were when we could go outside and hang out with our friends all day long without having to be indoors. So what I'm interested in is how you take technology like Wii Fit or some of the other computer games that require physical activity, and how you use those to motivate kids to get more engaged, realizing you've got a much more difficult challenge with today's generation of young children to get them to exercise than we did in the past.
Yeah. One example of where that's been done is in West Virginia, where they introduced Dance Dance Revolution in their schools. And I think that that's an important example and opportunity, and I think we need a lot more experience. That we need, you know, as adults, we tend to prescribe to children what we think is appropriate.
Like dodgeball.
Right. Yeah. But I think that kids have a better idea of that, and we need to invest much more strongly in understanding what they would like to do and how to meld the electronic media and the electronic environment with the physical activity environment.
But the key is to get them moving.
Yes, absolutely.
Thank you.
Thank you. Gentlewoman from Illinois, Mrs. Strakowski.
Thank you. I apologize for not being here for your testimony and the opening statements. A couple points I want to make. Earlier this year, along with Dr. Burgess, we introduced H.R. 2354 called the Health Promotion First Act. I hope you'll take a look at it. The goal of the bill is to identify ways to help people develop and maintain healthy lifestyles, promoting the kinds of living and working environments to encourage people to eat right, to be physically active, adopt behaviors that improve their health. And our bill, I think, takes innovative approaches of requiring collaboration across agencies to identify what the best practices and effective strategies for health promotion would be. So I hope you'll take a look at it. The other thing I wanted to tell you is last week I met with a woman. Her name is Rochelle Davis, and she's executive director of the Healthy Schools campaign in Chicago. And she has developed, along with the public schools, a collaboration on school lunches. And the Chicago Public Schools want to be early adopters of the Institute of Medicine recommendation changes in school meals that require more, like way more, vegetables and fruits and whole grains. But unfortunately, current USDA standards prevent that. So I think one of the goals that we have to have is look at the policies that exist right now and identify some of the barriers that we have to actually adopting some of the strategies that we actually know will work. We want to encourage states and localities to be innovative. I just went to my grandchildren's school and looked at the school lunch program. They actually happen to have a kitchen, so they can do more innovative things, but fewer and fewer schools now have their own kitchens. So we're looking more at, at the central delivery places, what kind of work that they're doing. Parents, I think, are actually getting more involved than I remember in what the school lunch programs look like, at least in my district. And I'm very, very encouraged by that. And I think once they figure out some programs that are cost effective, because always cost is an issue, that we can promote those. But I wondered if you could talk a little bit about the barriers that we have existing right now in our federal regulations that might prevent these kinds of things from being adopted.
Certainly the existing policies that govern school meals are a concern, and I think that there's a lot of interest in the child nutrition reauthorization bill, and in conversations that we've had with the USDA, there's great interest on their part in moving forward. Another important program, which is not in schools but has an equal impact in child care settings, is the Child and Adult Care Food Program, which is the recommendations of which are under review by the Institute of Medicine, and I think a report is forthcoming in 2010. And the hope is, I think, on USDA's part, that will help change the face of child nutrition in schools.
Anything, Dr. Huang?
Well, I just met with Dr. Thorne, the Deputy Undersecretary for Nutrition from USDA yesterday or 2 days ago, and I know that they're paying close attention to the new IOM recommendations, and so I agree with you, and I hope that...
You know, I did the food stamp challenge, I don't know if it's last year now or 2 years ago, or this was before 2 years ago, before the food stamp program got more funding. It was $1 a meal, essentially, $3 a day. And by the time I got to the produce section, fruits and vegetables, there was essentially no money left. I think I got 1 tomato for the week and a couple bananas or something. So again, I think that we want, especially since the new information on how many people rely on food stamps in this country. What do we call it now? It's not food smart.
Yeah.
What?
SNAP Ed, Supplemental Nutrition Assistance Program.
SNAP program, which of course is so much better than food stamps, which don't exist anymore, thankfully. But you know, we have to provide the avenues for people to. It's enough. You know, it's nice to say that families are supposed to do this and they should, you know, have healthy food. If you can't afford to buy those healthy foods, it's not going to happen. Any comments on that?
I concur. I think my colleagues from USDA told me that they're trying to work with $1.25 per meal. You know, that's kind of their budget, you know, with the school meals.
Right.
So your point is very well taken. I think it's very consistent with our message today.
I have a couple more. Oh, no, I don't. Okay, I'll yield back. Thank you.
Thank you. I think that completes our questions for this panel. I mean, there's just so much more to delve into, and you know, we're spending our time today, what little time we have, in trying to delve into some of these concerns. But I know that there's a lot more that we have to do. But I do appreciate your input, and we may have some additional questions that the clerk will send you within the next 10 days or so as follow-up. So thank you very much.
Thank you.
And I'd ask the second panel to come forward. Let me introduce our second panel. And starting on my left is Ron Jaworski, who is with the JAWS Youth Fund and the National Football League Play 60. These are both organizations that you either started or have been involved with, and thank you for being here today. We appreciate it. Dr. Sandra Hassink, who is chair of the Obesity Leadership Workgroup for the American Academy of Pediatrics. Jeremy Nowak, Ph.D., who's president and CEO of the Reinvestment Fund. Mary Sophos, who is senior vice president of government affairs for the Grocery Manufacturers Association. And finally, yes, Ms. Risa Levizo-Murray, who is a doctor and president and CEO of the Robert Woods Johnson Foundation. I appreciate all of you for being here. I know you have innovative ideas about how to deal with some of these childhood obesity problems, and you know, each of you have been renowned, if you will, in your own sphere in dealing with that. As I mentioned to the first panel, we have we asked you to give us a 5-minute opening statement, then we'll have some questions, and we'll start with Mr. Jaworski.
Chairman Pallone and members of the Subcommittee on Health, it's great to be with you here this morning. Good morning to everyone. I'm having so much fun here this morning, I may hang around and cover a football game on Monday night. Why not? It's been a great Great stay thus far. I really want to thank you for the opportunity to testify on an issue of great, great importance to me, to my foundation, and to the National Football League, the epidemic on childhood obesity. I'm proud to testify before you today in two capacities. First, I represent the United Way JAWS Youth Fund, a partnership my family created more than 10 years ago with the United Way of Camden County, New Jersey. Through the United Way JAWS Youth Fund, I am proud to have delivered close to $3 million to more than 70 nonprofit organizations providing service to children ranging from ages 7 to 18. In addition, I'm also testifying on behalf of the National Football League and its signature community relations initiative, the Play 60 campaign. Launched in 2007, the Play 60 campaign is a national youth health and fitness campaign focused on increasing the health and wellness of young fans and combating childhood obesity by encouraging youth to be active for at least 60 minutes a day. Mr. Chairman, the facts surrounding childhood obesity in this country are startling. They are startling. Nearly 1 in 3 children and teens in the U.S. are obese or overweight. That's 1 in 3. More than 23 million youth that's 23 million obese or overweight. Startling numbers. In the last 2 decades, the rate of overweight children has doubled. We know that youth who are overweight or obese are more likely to have health risk factors associated with cardiovascular disease, such as high blood pressure, high cholesterol, and type 2 diabetes. In contrast, the benefits of good health translate to the classroom, where studies show that fit students are less likely to have disciplinary problems. Healthy students also perform better on standardized tests. It is possible that these facts, while shocking, should not come as such a surprise when we consider that more than 60% of children ages 9 to 13 do not participate in any organized physical activity during non-school hours. The number of idle children is increasingly significant when schools around the country find it challenging to offer physical education classes. Sadly, very sadly, 50% of the schools do not provide physical education in grades 1 through 5. Even more startling, 75% do not provide physical education for grades 6 through 8. This is not a new issue for me, unfortunately. Mr. Chairman, you may remember back in 1989, the New Jersey public schools were considering eliminating physical education classes. I was very proud to lend my voice along with that time physical fitness guru Pat Croce, who became the Philadelphia 76ers president and part owner, along with Ed Solomon, a legislator in New Jersey, and we defeated that proposal. We were successful, and physical education remained a requirement in New Jersey public schools. It's amazing. Here we are, 21 years later, still talking about the same things. I am pleased to also announce that I'll be joining the United Way's National Board in 2010. Last year, the United Way system established a 10-year health goal to increase by 1/3 the number of youth and adults who are healthy and avoiding risky behavior. In order to achieve its 10-year health goal, United Way has made combating childhood obesity a priority, which requires the resources and commitment of all of us working together. One of the best examples of the type of health and wellness activity that JAWS Youth Fund supports is Steve's Club in Camden, New Jersey. In addition to being the most dangerous city in the country, Camden's childhood obesity rate is a staggering 60%. The United Way's JAWS Youth Fund is proud to help fund Steve's Club, an organization that provides fitness training to Camden kids, giving them a place to get their bodies healthy and stay off the streets. There's a young man that's joining me here today, Jose Enriquez, a former gang member turned fitness guru. It's a great story to be told. Jose's been working out at Steve's Club for years. He recently turned 19 and received his official personal trainer certification. He trains kids in the club. He visits kids in Camden School. The JAWS Youth Fund even bought a van for him so he could drive around and sell fitness to the kids in Camden, and trust me, they need it. And a real good friend of his, through the great leadership and inspiration of Jose, lost 50 pounds. There's a real example of the good work being done in our community. Now, I can give you a number of anecdotes and great stories, but I don't know if they'd be boring, but I won't. Maybe there'll be another time I can give you more of those. But on a broader scale, I'd like to discuss the NFL's Play 60 initiative. Fantastic program. And describe for you some of the terrific work they and all the member NFL clubs do in our community. Play 60 is a multidisciplinary campaign that addresses the issue of childhood obesity through the national outreach and online programs, as well as grassroots initiatives implemented via the NFL's in-school and after-school and team-based programs. And the players, the leadership of the NFL does a magnificent job. NFL Play 60 was designed to build on the leagues and teams' long-standing commitment to health and fitness. The NFL decided to focus on the issue of childhood obesity because it recognized not only the public health crisis facing our nation, but also the NFL's unique place in our culture and its ability to influence attitudes and behaviors, especially among young people. Since the inception of Play 60 in 2007, the NFL has committed more than $200 million to youth and health fitness through media time, PSAs, programming, and grants. They put their money where their mouth is. This year alone, more than 700 events have been hosted by all 32 National Football League teams who implement Play 60 in their local markets. NFL Play 60 is supported year-round by many of the NFL's most prominent players, including Drew Brees, Eli Manning, DeMarcus Ware, Jason Witten, and Troy Polamalu donate their time to help the program. NFL Play 60 promotes the importance of getting 60 minutes of physical activity per day. That's it, 60 minutes. Just give us 60 minutes. Kids are encouraged to find their own ways to get active, whether it's taking advantage of the local playground, which have been rebuilt, playing foursquare in the schoolyard, or just walking around with some friends having some fun. Play 60 represents organized sports, including youth football, as a very good way to get active, but certainly not the only way. And another story, through the league's Play 60 Super Bowl contest, 12-year-old Jared Doubt from Erie, Pennsylvania, took his family to Arizona for the Super Bowl 2 years ago, enjoyed the experience, delivered the football for the kickoff. Well, when he went home, he went back and started working outside on a regular basis. His sister also plays soccer, and he coaches the soccer team after school. Great real-life stories. The Super Bowl contest is only one way the NFL is involved. With South Florida hosting the Super Bowl this year, the NFL is asking all of its star players, because the Pro Bowl will be there. I'll get a plug. I'll be covering the Pro Bowl. I'm going to get a plug in for that. We'll be covering the Pro Bowl, and we will be out in the community. I will be out in the community with the Pro Bowl players, the elite players of the National Football League, surrounding Miami and all the communities in the area, promoting how important it is. I look forward to participating in that blitz and being part of such an exciting project. And this is just an illustration of the great work being done by the NFL in this area. Obviously, I've attached some testimony in here and descriptions of some of the other programs that are involved with the National Football League. But, Mr. Chairman, I do want to commend you and this subcommittee for holding this hearing and focusing congressional attention on this very vital public issue. I certainly do look forward to being with you again, and whatever I can do to move this forward, I'll be there. Thank you.
Thank you. Thank you, Mr. Jaworski. I appreciate it. Dr. Hassink?
Well, good morning, and thank you. I appreciate this opportunity to testify today on childhood obesity, and I'm proud to represent the American Academy of Pediatrics. Allow me to share with you a story. Janie is a 9-year-old patient of mine in our obesity clinic. When she first came to us, her BMI was 35. That means her weight was about 150 pounds, and she was not doing well in school. As we talked, I learned a number of things about this little girl's life and health habits. Janie told me she did not eat breakfast. She had lunch at school but bought extra snacks. After school, she would have cookies at her grandma's house and was drinking 6 cans of soda and several glasses of juice a day. Janie did her homework at her grandmother's house, but she didn't go outside often because the neighborhood wasn't safe. She was having 5 to 6 hours of screen time each day, and she went to bed around 11 o'clock while watching TV in her room. She is phys ed in school only 1 day a week, and she had to use her asthma inhaler often, so exerting herself was uncomfortable for her. She was being teased and bullied by some of her peers, which made her unhappy and caused her schoolwork to suffer. How do we help a child like Janie? First and foremost, we must recognize there is no single factor responsible for obesity in a case like this. Obesity, in the end, is a result of a complex interplay of different issues. Any solution must therefore be equally complex and multifaceted. Davidson and Birch describe the socio-ecological model of obesity, which illustrates the many factors that impact weight. The concentric circles of this model show the issues related to the individual, family, community, and larger social structure that either promote or inhibit good nutrition, physical activity, and overall health. Any meaningful attempt to stem the rising tide of obesity must address many of these issues simultaneously over a prolonged period of time in order to produce sustainable change. The healthcare community is currently engaged in a race to learn what types of intervention we can employ in medical practice to reduce pediatric overweight and obesity. A number of common elements among successful interventions have begun to emerge. The medical home. Every child must have access to a medical home that will provide continuity of care and coordinate the services received from various sources. Without a medical home, the child and family receive fragmented and inconsistent advice and services. In the case of obesity, where progress must be tracked methodically and longitudinally, a medical home is critical to the success of any healthcare intervention. Levels of care. The Expert Committee on Obesity in 2007 recommended that patients have access to 4 levels or stages of care explained in my written testimony. These stages of care allow healthcare practitioners to tailor their approaches to the child and family based upon their current health status, readiness to change, and other special needs. Public and private health insurers must provide appropriate payment based upon the complexity of the child's case and the level of service required. Family-centered care. Successful interventions cannot focus upon the child to the exclusion of the rest of the family. Children have limited control over the foods they eat or are served, the amount of physical activity in which they engage, and other key factors that determine their health. The engagement of the entire family in behavior change is critical to the success of a practice-based intervention. While practice-based interventions are a vital tool, we must also recognize that health is profoundly affected by the community in which a child lives. Without equal attention to community-based policy interventions, practice-based approaches have a much reduced likelihood of success. Child nutrition programs. Federal child nutrition programs should require all participating schools, child care providers, and other institutions to follow the dietary guidelines in serving meals and snacks to children. The Secretary of Agriculture should have authority to regulate competitive foods. The AAP strongly supports the recent updates to the WIC food packages and breastfeeding promotion, which is an important component of establishing good nutrition and appropriate feeding habits at the beginning of life. The reinstatement of compulsory daily quality physical education classes is vital to children's health and can also impact their ability to learn in the classroom. Screen time for children should be limited to less than 2 hours a day. Our physical environment, the built environment, determines to a large extent how children travel, move, and play. Modern communities have been created for cars, not children. The AAP has issued recommendations for the design of communities to provide healthy, active living. Sugar-sweetened beverages are a significant source of empty calories in many children's diets. The AAP recommends eliminating sweetened drinks in schools and strictly limiting soft drinks and fruit juice in children's diets. The AAP also supports taxation of sugar-sweetened beverages as a method of both reducing consumption and raising revenue for other children's health priorities. Finally, the AAP supports a ban on junk food advertising during programming that is viewed by young children and calls upon Congress and the FCC to prohibit interactive advertising to children. Children and families deserve all the help we can give them in combating this epidemic, and I thank you, Mr. Chairman, for this invitation and look forward to your questions.
Thank you, Dr. Hassink. Dr. Nowak?
Thank you. Mr. Chairman, distinguished members of the Subcommittee on Health, thank you for inviting me to testify. My name is Jeremy Nowak. I'm the president of the Reinvestment Fund. We're a community development financial institution with principal location in Philadelphia, although offices in Baltimore and Washington, D.C. We manage about $600 million in assets and are active throughout cities and towns in the Mid-Atlantic. I'd like to bring an economic development perspective to the issue of childhood obesity. A comprehensive approach to reducing childhood obesity and diet-related diseases, in our view, has to take into account the issue of access to high-quality, fresh food. While having a choice between healthy foods and unhealthy foods will not in and of itself solve the problem. A lack of healthy food choice will certainly keep us from a solution. We've provided about $1 billion of loans and investments into some of America's poorest communities. During the past 5 years, we've managed the Pennsylvania Fresh Food Financing Initiative, which was referenced in the first panel. We've done this in collaboration with the Food Trust, a nonprofit policy and advocacy group, and the state of Pennsylvania. Both have been really important partners. We are, as far as we know, the most successful economic development effort in the nation dedicated to ensuring that all communities have access to competitively priced fresh food. In that sense, we are more than an economic development initiative. We are also a health and a community building program, creates local jobs, revitalizes neighborhoods, and demonstrates the widespread demand for quality food among working and low-income families. In my testimony, I want to talk a little bit about why the Pennsylvania Fresh Food Financing Initiative works and why we think that a national fresh food financing initiative ought to be part of any comprehensive attempt to reduce childhood obesity. The most important point I want to leave you with, if I leave you with nothing else, is that this problem is absolutely solvable from the perspective of access. This is a solvable problem from the perspective of access. So now let me talk about the Pennsylvania Fresh Food Financing Initiative. We're a collaboration of public, private, and civic sectors. It's created through the initial organizing of the Food Trust, who brought together public officials, healthcare practitioners, consumer advocates, and retail operators. It was very important to have the retail industry and the private sector in at ground zero to design this program. Together, we shined a light on the problem through a data-driven analysis and then a programmatic strategy. The result was a partnership with the state of Pennsylvania, and I'll talk a little bit about the use of the money later, put up $30 million, and the Reinvestment Fund matched it on a 3-to-1 basis with $90 million of private money. Since 2004, the year we launched, we've approved the financing of 81 projects from full-service 70,000 square foot supermarkets to 900 square foot shops, from traditional entrepreneurs to co-ops and public markets, like the one I noted that the congressman from Lancaster County was here in the first session, and we did a public market in the city of Lancaster, which was a terrific market. Since then, that has resulted in 1.5 million square feet of new development, about 4,800 full and part-time jobs, and fresh food access to more than 400,000 people that did not have it before. The financing efforts have created new stores in abandoned lots, refreshed stores that had previously been closed, and led to significant expansions with enhanced inventory selections. They're in the inner city, but they're also in rural Pennsylvania, and they are in small-town Pennsylvania, places like Lancaster, Gettysburg, York, throughout the state. There are 6 things that I detailed, and I won't go through them at great length, but there are 6 things that I detailed that are key to our success. 1, we use some of the money for subsidies, small subsidy grants, to help entrepreneurs incur some of the barrier to entry costs that are there, and also to help move private debt into the projects where credit enhancements were needed. Number 2, we did this through very flexible financing. We made sure that access to capital would be there for customers in a variety of different financial products based on the need of the customers. We used multiple strategies. This was not just about big supermarkets. It was about enhancing the inventory of small corner stores. It was about helping the small bodega expand their inventory and opening up a second store, but it was also about the large retail operations. We targeted our money using a very sophisticated spatial database. We did it with market expertise. We know how to do the underwriting, the business and the real estate underwriting, and we've had a high quality of impact transparency throughout. This project can be replicated. It's been cited as an innovative model by the U.S. Centers for Disease Control and Prevention, the National Conference of State Legislatures, Harvard's Kennedy School of Government, and the National Governors Association. It can build on the demonstrated success of the program. There are a variety of states right now, Louisiana, Illinois, New Jersey. New York is going to announce it today at 11 o'clock. Governor Patterson is going to announce the beginning of such a program. that are in various stages of development. We're working, in fact, in New Jersey, and we hope to announce new stores in Newark, Atlantic City, and Patterson sometime quite soon. In partnership with the Food Trust and Policy Link, a national group that specializes in the replication of proven initiatives, we've been in discussion with members of Congress and with the Obama administration regarding the design and capitalization of a national initiative. The idea of a national program is not meant to replicate local initiatives, but to accelerate their development. Anything that happens has got to facilitate private money and be matched by local government. Nor is it meant to crowd out private investment, but once again to facilitate its entry. It was easier, frankly, to come up with $90 million of private money 5 years ago than it is today. And in fact, the way we would use a grant money or public money to facilitate private money would be a bit different right now than it was 5 years ago. We've developed, and I know my time is short, so I'll just say a few other things. We've developed a spatial statistical model that uses retail food data, a distance to store analytic for grocers with annual sales of $2 million or more, and a real estate cluster model that we think conservatively estimates the market viability for additional fresh food retailers. Based on this analysis, we think that there are 23 million Americans living in communities without access to high-quality fresh food, even though there is commercial viability for store location. This is the critical issue. If we're going to solve the access problem, you can only solve it at the intersection of social need and market viability, retail viability, and this is possible. If there was a $1 billion program, in our view, from the federal government that was matched at a minimum of $1 per dollar, we could improve health access to 15 million people, help create or improve 2,100 stores, rehabilitate 50 million square feet of retail space, and create and retain 29,000 full-time jobs and 119,000 part-time jobs based on the metrics that we extrapolate from the state of Pennsylvania. I will leave you with one other thought. There's clearly a bridge here between economic development and health impacts. People on this panel and the people on the panel before know more about the health issues as it relates to childhood obesity. We know there's no simple answer to this, but it's clear to us that access is a piece of the solution puzzle. We know it's also about education, but we know that we will need an educational commitment that is as significant as the kind of commitment we had when we first started to target anti-smoking ads to young people. We know it's about more sustainable agricultural processes, but surely the necessity for fresh food access has to be part of the toolbox of solutions. Let's not forget the place-based factors at work here. They are real. They're the ones that we live with all the time in the work that we do. It is not just an urban issue. It is also a rural, small-town issue, and there are opportunities to solve it and signposts that say that there's a way to get it done. Thank you again for inviting my testimony. I wish you the best as you grapple with the critical issue of childhood obesity, its link to disease, and the best intervention strategies for us going forward. Thank you very much.
Thank you, Dr. Nowak. Ms. Sophos?
Thank you, Mr. Chairman and members of the subcommittee. My name is Mary Sophos, and I'm Senior Vice President and Chief Government Affairs Officer for the Grocery Manufacturers Association. I greatly appreciate having the opportunity to be here today. It's critically important that we identify and support strategies that work to reduce childhood obesity. This year, Mr. Chairman, we worked together to pass sweeping food safety legislation, and our industry is committed to work with you again on this issue. Since 2002, the food and beverage industry has taken significant steps to create and encourage healthier choices. In recent years, we have changed our packaging to promote portion control, and we have reformulated more than 10,000 products to reduce or remove saturated fats, trans fats, calories, sugar, and sodium. Changes in advertising practices have resulted in a significant shift in the product mix of advertising viewed by children and by adults as companies continue to respond to consumers' desire for healthy products and a healthy lifestyle. We think that the key to helping individuals achieve and maintain a healthy weight lies with developing the habits and skills to incorporate energy balance into our daily lives, something Dr. Huang referred to as well. This means balancing calories consumed as part of a healthful diet with calories expended through physical activity. We think this should be the focus of our collective efforts. We're beginning to see what works and the importance of this energy balance message. 3 years ago, GMA and its member companies helped create the Healthy Schools Partnership, a partnership of the American Dietetic Association Foundation, PE for Life, and the American Council for Fitness and Nutrition. The HSP integrates a nutrition curriculum into the PE for Life physical education classroom, training registered dietitians to be nutrition coaches, to coach and motivate students alongside the PE for Life teachers. And I would say that PE for Life is the organization that documented the statistics that Congressman Murphy was talking about on the improvements in academic performance and discipline. The initial evaluations of the nutrition component of this program undertaken by UC Berkeley have been extremely positive. Although they started out roughly the same, after coaching, students in the intervention schools had scores significantly higher than those of students in control schools, particularly in understanding how to maintain a healthy body weight and recognizing the value of eating more fruits and vegetables. After RD nutrition coaching, twice as many students from intervention schools, 31%, compared to the control group, 17%, were eating vegetables in school. And as we know, consumption of fruit and vegetables is one of the key indicators of a healthy weight in children. It's programs like Healthy Schools Partnership that are making a difference in children's lives. I would note that the original schools, which are in Kansas City, Missouri, are in the urban core, and 75% of the student population is eligible for free or reduced price lunch. This year and next, we will be expanding the Healthy Schools Partnership into additional schools in the Kansas City metropolitan area, into Des Moines, Iowa, and a tribal community in Iowa, a school in Chicago, and 4 schools in Washington, D.C. This expansion is being made possible by an $8.5 million grant from the Healthy Weight Commitment Foundation, which was launched in October of this year. It's a coalition of 40 retailers, non-governmental organizations, and food and beverage manufacturers who have launched a $20 million national multi-year effort designed to reduce obesity, particularly childhood obesity, by 2015. The HWC will promote helping ways to help people achieve a healthy weight through energy balance in the places where people spend most of their time, schools, workplace, and the marketplace. And because it's very important that solutions be evidence-based, all the initiatives under the Healthy Weight Commitment Foundation include the use of objective outside expert evaluators. Notably, the Robert Wood Johnson Foundation will be serving as outside expert evaluator on the marketplace, and particularly with respect to calories in and calories out, and we very much appreciate their engagement. And the National Business Group on Health will evaluate the workplace initiative. Finally, early next year, the Healthy Weight Commitment Foundation will launch a public education campaign aimed at children ages 6 to 11, their parents, and caregivers to help raise awareness about the importance of balancing a healthy diet with physical activity. Mr. Chairman, our industry will do more to meet this complex challenge, and we look forward to updating you on the activities of the Healthy Weight Commitment Foundation and the Healthy School Partnership in the coming months. And Congressman Braley, when you were out of the room, I noted that this unique partnership in the schools we're bringing to Des Moines, Iowa, and a tribal community in Iowa this year and over the next several years. In particular, we urge Congress to increase investments in physical education, nutrition education, and to encourage changes in the built environment and to support workplace wellness programs that recognize and reward improvements in health among employees. We think these are shown to be among the most promising strategies, and where additional investment so that we can bring these pilot programs to scale is desperately needed and would actually produce significant results. Thank you very much.
Thank you. Dr. Levizo-Morey.
Thank you. Congressman, Chairman Malone.
I think you need to either turn it on or move it closer to you.
There we go. I think it's on now.
Okay.
Mr. Chairman, thank you and other members of the committee for this opportunity to testify about innovative solutions and strategies to address the epidemic of childhood obesity. The Robert Wood Johnson Foundation has committed to invest over $500 million in reversing the epidemic of childhood obesity by 2015. We focus our approaches on research that suggests how to use nutrition and physical activity, which are both required in order to reverse this epidemic. There are 5 key areas that we think are important for change. First, providing only healthy foods and beverages for students at school, improving the availability of affordable healthy foods in all communities, increasing physical activity before, during, and after school, improving access to safe places where children can play, and regulating marketing to children. In my written testimony, I gave a number of examples of projects across the country that we are funding in this area. However, at this time, I want to tell you a story about a young man, Kenyon McGriff, whose picture is shown here. Kenyon is an African-American teenager who has a family history of diabetes and heart disease. And when he was 15 years old, a few years ago, his physician told him that at 270 pounds, he was at risk for diabetes and a whole host of other chronic illnesses. Kenyon took his physician's warning seriously. He got help. He joined a running club. He changed his diet. But even armed with the best intentions and all the good information that he had, Kenyon still struggled to get healthy because his neighborhood, West Philadelphia, was home to dozens of fast food restaurants, takeout joints, and convenience stores that did not sell healthy foods. As he used to say, it takes income to be healthy, and his school didn't offer healthy choices. Lunch for him, as he said, was burnt pizza and often soggy hoagies. Now, Kenyon did his very best to eat healthfully on the budget that he had, and he stayed committed to his running club, often running through the traffic-clogged streets of West Philadelphia. He and his teammates set and met a goal to complete the Philadelphia Marathon. Now, Kenyon is an aspiration and an inspiration for all of us, but there are a lot of kids in neighborhoods across the country who get discouraged when they don't have the help and the means to overcome the environmental barriers that make it so hard for them to live well, to eat well, and to be healthy. We know that where we live, learn, work, and play has a tremendous impact on how healthy we can be. Our environments, that means the places that we eat our food, the choices that we have in school and in restaurants, the threats that we may face because of crime and traffic, and the lack of social support. Those social factors can create real barriers to health. And with those barriers, it's no wonder that so many kids are overweight and obese. In communities across the country, it is far too much easier to make unhealthy choices rather than healthy choices, and we must change that. What if the corner grocery store in Kenyon's community agreed to stock healthier foods so that kids had more healthy options and nutritious snacks as they walked home from school? And what if they limited marketing and advertising of unhealthy foods? Well, that's happening in Baldwin Park, California, under a program that we're funding. And what if community coalitions work to improve safe access to improving routes to schools that connected the schools, also connected neighborhoods and parks, and also provided job training and employment opportunities for young people who could be healthy park ambassadors? Well, that's happening in Chicago. And what if faith-based communities worked in partnership to provide direct transportation routes between neighborhoods that have supermarkets and those that don't? Well, that's actually happening in Nashville, Tennessee. We know that in communities across the country, there are ways to make it easier for children and families to make those healthy choices. It is critical that a diverse set of partners working together affect community change. It's the responsibility of families, of schools, of health providers, of industry, of government, of really the entire community. By solving this epidemic, we're going to have to rely on the leadership and the coordination at the federal level, but also across departments and agencies at the state and local level as well. Transportation, housing, education, agriculture policies, along with health policies, will have an impact on the kind of health that our kids will have by giving them access to healthy, nutritious foods and safe streets and environments. Together, we must ensure that every community is healthy in order to reverse this epidemic and ensure that all of our children can be healthy and grow up to be healthy adults. I thank you again for this opportunity to testify today and look forward to your questions.
Thank you, and let me thank you all. We'll take questions now from the members. And I'll start with myself. As I mentioned, the real purpose of this hearing was to try to get your innovative ideas and see, if we could use them somehow in a broader way, either through government, private sector, or whatever. And of course, being that we're in Congress, I always stress, what the government can do, if it can do anything. I can't help but focus on the two individuals who mentioned New Jersey here today, because both Mr. Jaworski and Dr. Nowak brought up New Jersey several times. And so my questions to the two of you are related to this whole issue. In other words, like Mr. Jaworski, you particularly talked about, well, you mentioned, keeping a phys ed requirement in New Jersey. I mean, that's a government function. In that case, the state. You mentioned the innovative program in Camden. I've been actually go to Camden quite a lot, even though it's, like an hour and a half away from my district, because there's a ministers association there called PICO, P-I-C-O, I forget what it stands for. And when we were doing I remember in particular when we were doing the S-CHIP, which is Expanded Children's Initiative, which we passed and the President signed earlier this year, before we got into the larger health care reform, and they were very supportive of it. They asked me to come down and show, what a difference it would make if we had the S-CHIP program expanded. It's called Family Care in New Jersey. And I was really struck by a number of things just in my couple days visiting Camden. A lot of the drugs being sold openly on the streets. So tell me a little more. I mean, what you mentioned, Steve's, what was it, Steve's Club? That was it's like a gym that you fund. Is there any way that can be expanded, or we could do something like that, beyond what you do? I take it it's all privately funded by you, from what I could understand.
Yes, Chairman. The Steve's Club is privately funded. At a golf tournament I run every year to raise money for the Jaws Youth Fund, we earmark one of those community organizations that will receive the funds. And my family and I visited a number of the organizations throughout Camden and South Jersey and kind of determined the needs in our community. And we were very, very impressed, in fact, blown away by the effort of the young boys and girls at Steve's Club. These are inner-city kids that are really trying on their own to make a difference, and we felt we needed to do something to help them. So we were able to get money to them. We got local businesses to chip in so we could buy this van so actually Jose could drive around and bring these kids over to the club. Excuse me a second. It was pretty impressive when you give people a chance. They'll make things happen, and it was happening. And there were other things that happened. I mean, to single out Camden, but in the city of Camden, there's not a grocery store really in the city. It's on the outskirts. And they did a study, went into some of these local corner grocery stores, and there were no groceries. There were no fresh fruits. There were no fresh vegetables. I mean, those are, things that we're hearing about here. So really the mission here is to just enlighten people of what's really going on out there. And, I just felt that part of the organization I have, my Jaws Youth Fund, to do what we can to help. And Jose is a real living example of that, and there are probably hundreds of other. But there are needs in our community.
Well, Dr. Nowak, not only following up on what he said, but you mentioned that your Pennsylvania initiative now, you're doing this in a number of cities in New Jersey. You mentioned quite a few. And you said it was a public-private partnership. Again, same essential question is, how do we replicate this? Is there a federal role? Is there something we can do to expand this, and tell us a little more about it?
So I I believe there is. Could I just say one word about Camden?
Sure.
We actually work with the PICO affiliate very closely in Camden. Camden Church is organized for people and have done hundreds and hundreds of housing units that we finance with them. Ron is right. There is not a full-service grocery store with fresh fruit and vegetables in the city of Camden. We are a city of 90,000 people. We're actually working on a site right now. One of the extraordinary things that's happened recently in Camden with the expansion of Cooper Hospital, Rutgers University, is starting to get some development in the central part of the city. Many of the supermarkets that we have financed in the inner city are right on the edge, interestingly, between middle class and low income neighborhoods. And so the entrepreneurs are able to build markets that are able to draw from both. And there's a tremendous lesson there. And we think there's great opportunity right now in the city of Camden. We're working with the Economic Development Administration in New Jersey. They've put up some debt, and we have also for the grocery stores. I think the role of the public money is always and only to pay for costs that the private sector can't pay for because of a market failure or because of some legacy cost that simply can't be incurred. I mean, if you look at a place like Camden, there are land costs related, for example, to environmental reclamation that simply no one can.
Also, I remember with PICO, I know I'm taking my.
South Camden, right?
There was also the problem with what do you call it, where the land or the houses had these tax liens that made it very difficult for them to be transferred or reused too. That was another issue.
Right. So the public role is to help get private money in or to pay for certain costs that can't be incurred by the private sector, but only to do it in situations where you believe there is market viability for a high-quality retail operator. I think now is a great time, frankly, because many of our urban operators, as an example, have found that cities and small towns are places where they have now more competitive advantage. These are the independent operators than they do in places where, frankly, they can't compete with the 130,000 square foot superstores. And so the West Philadelphia site, where hopefully Kenya now is buying his groceries at 52nd and Parkside that we recently financed, there an operator with 12 grocery stores, a guy named Jeff Brown, can compete. He's now grossing in West Philadelphia close to $1 million a week in that store and serving low-income people, doing it successfully, making money in a low-margin business, 1% to 2% margin business, but he got some public help to do that through new market tax credits and also through a grant that helped with land reclamation for an environmentally toxic site.
My time is up, but I want to follow up with both of you on some of these initiatives, particularly in my state, but obviously you can apply it anywhere. I appreciate it. Thank you. Gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. I was going to ask my first question to Mr. Jaworski. Since my 401k is down about 40%, I was going to ask him for a tip on the upcoming Super Bowl, but I guess we don't know the teams yet, and that question may be a little inappropriate.
I'm pretty good, by the way, at it, so you may watch.
I'll hold back on that one. But, Mr. Jaworski, I first of all commend you for the work you're doing with the JAWS Youth Fund that you had so much to do with organizing, and of course the NFL 60 program as well. Let me ask you, in regard to school PE programs, my good friend from Iowa, Mr. Braley, would discuss that and ask some questions of the first panel. And I'm from Georgia, and I was on a school board, started my political career actually on a local school board, and every time something got cut, and there was always this struggling to have enough dollars, it would be physical education. And And I think Bruce is right. I mean, when they had it, it'd be dodgeball. It wouldn't be something that was aerobic exercise where the kids clearly. You're a professional athlete, and I would just like to hear your opinion in regard to the importance or lack of it, if you feel that way, of getting physical education back in our school systems.
Well, Mr. Gingrich, obviously it's very important, and as a student at Youngstown State University, I was a health and phys ed major, so I learned through my curriculum the value of health and physical education and maintaining a quality lifestyle from eating properly and maintaining the body properly. And obviously, as a professional athlete, it was paramount that I maintain my body in the most opportunistic way that I could. And I was very fortunate to have personal trainers, strength coaches, proper nutrition, nutritionists, all those things that go along with being a professional football player for 17 years. But what I learned at Youngstown State was the importance of physical education, to have a sound mind, to have a sound body, to eat foods nutritionally. And as I grew a little bit older and a little bit wiser, and I saw that some of these programs in grade schools and high schools and middle schools were being eliminated, it was unconscionable to me, knowing personally the value of physical education. It is invaluable. What the NFL is doing is not trying to solve the physical education problem. It's just saying, hey, 60 minutes. Yeah. Give me 60 minutes. I'm not saying take 4 hours a day, but find a way to get off the couch and give me that 60 minutes. And even we hear about couch potatoes, computers, and all that. The NFL with EA Sports now has EA Fit, so you can actually watch your computer like some people do with Wii and play golf and bowl and play tennis. You can do all those things. So I think that there is now the opportunity, even through the new wave kids, so where they can, not sit on the couch, but they can get some sort of physical activity. And we're only talking for 60 minutes.
Absolutely. Well, thank you. Dr. Hassink, I referenced the American Academy of Pediatrics and your upcoming testimony when I was talking to the first panel, and you heard my question to them, and I know in your testimony, it's great testimony and very, very comprehensive. You do seem to put a strong emphasis on the use of, by definition, taxpayer dollars to promote a social norm of good health. A very comprehensive approach, but as I said earlier, these folks have to be paid. Do you think that parents can provide that social norm of physical activity and give children the support day in and day out to make these healthy choices?
Well, I often tell my parents in clinic, it's a little right now like guerrilla warfare for the families. They're trying to make choices in an unhealthy environment oftentimes, and so the first step is to help them with knowledge and skills to make the healthy choices, and then get them in a situation when they go back home to have healthy choices to make. So I think parents need all the support we can give them in terms of understanding what needs to be done, and then further support and access to make the right choice. I honestly say, I've been doing this for 22 years, you don't meet parents who don't want what's best for their children. Our parents want healthy children. They're struggling to know how to get them. They're frustrated with what's available to them. Some of them are frustrated with school meals. Some of them are frustrated with the fact that it's a competitive sports environment in many schools, not a participatory environment. So the child who's a little slower to develop their skills, maybe a little heavier, they get opted out of sports pretty quickly in the school environment. And then if you don't have PE, they can't, where do they learn teamwork? Where do they learn skills? Where do they learn sports? And that tails off very quickly. So I think I see the parents, they want to try, they will learn, they do need help, but when you send them out and they're not supported, it becomes very difficult for them. And it's sad because they want healthy children.
Thank you. Mr. Chairman, I see my time has expired. Will we have a second round, I hope?
The only limitation on it would be, I think we might be having votes soon. But let's see. If not, we can, assuming that the panel can stay, and there's only 3 of us. But let's...
Mr. Chairman, before I yield back, I want to ask unanimous consent to submit my opening statement for the record. I didn't get an opportunity to do that. And thank you, Mr. Chairman. At this point, I'll yield back then.
Without objection, so ordered. Mr. Braley.
Thank you, Mr. Chairman, and I also would request unanimous consent to submit my opening statement for the record.
So ordered.
Dr. Hassink, I want to follow up on your comment, which several of the other witnesses have talked about, and that is parents frustrated with food choices in school. And I think that's one of the reasons why I introduced the Healthy Choices for Kids Act earlier this year, to promote the idea of labeling the foods being served in school cafeterias with nutritional information, which would authorize a pilot program in 100 schools to label the foods being served with nutritional and caloric information at the point of decision. And I would highlight there's a recent study that has actually shown that students were more likely to make healthier food selections when the nutritional information was available next to the food item being served. And that was a 2005 issue of the Journal of Child and Nutrition Management, which found that students' choices for more healthy entrees increased after reading nutritional content labeled next to the food item. And my hope is that the Healthy Food Choices for Kids Act will be included with the Child Nutrition Program's reauthorization. And I've been working with the Education Labor Committee and Chairman Miller to include this legislation in that program. I also wanted to comment, Dr. Leviso, more on your comment about safe routes and the importance for kids who increasingly face difficult environments getting to school. And the Transportation Committee, which I previously served on, has jurisdiction over the Safe Routes to Schools program, which is federal dollars being used to enhance the security of routes to schools for kids. And when I was in Denver last summer for the Democratic Convention, I went to an elementary school in Denver that is combining a lot of the aspects of what we've been talking about here today, where kids who rode their bikes to school would be given a bike helmet with a barcode on it. And they would ride past this computer terminal, which made a clanging noise to reinforce auditorily with the kids they'd ridden their bike to school. And that would automatically then record it in the school computer, and the more days they rode or walked to school, they would get points, and at the end of the school year, they got some kind of prize, maybe an iPod or something, depending on the level of participation. Now, here was the biggest complaint that they got, because parents got more engaged in riding their bikes to schools with kids, that when it started to snow in Boulder, they were getting complaints from parents who were being forced to ride in the snow with their kids who were obsessed with scoring points and getting physical activity. So I think that's a good problem that we have in this country. Then we need to have more of those problems. But one of the things that I've also heard today, and that is that that recreational time for kids has increasingly gotten structured. And Mr. Jaworski, I want to ask you this question because it's a paradox that's been created by some of the activities of the NFL. I was a kid who grew up with punt, pass, and kick. I also coached youth sports using jerseys donated by the NFL, which was a great thing to attract interest in the program. But part of the problem we have with youth activities is that a lot of kids and a lot of parents seem to have bought into the concept that unless you're in a structured team sports activity, there is no value to participation. So can you tell us some of the things that your foundation and the NFL is doing to take a broader message to kids about the need to engage in unstructured play, aerobic activities that have nothing to do with team participation, and get us to the point where we have a balanced, comprehensive approach to team building and exercise with youth today?
Yes, sir, Mr. Braley. In fact, I think, because we hear Play 60 really sponsored by the National Football League, the conception is some organized kind of sport. But it's real simple. Just 60 minutes of activity. It could be a walk in the park. It could be a ride on your bicycle. It does not have to be an organized team activity. So I think that, that should be clear. That's not what they're saying. You need to be a team, and although there certainly is some leadership skills and social skills that you acquire by being involved with a team, that's not the driving force behind the program. It's 60 minutes of activity, and be creative as you want to find a way to get your exercise in. And I might just add, with the JAWS Youth Fund, we've had 5K runs, fitness fests, over 1,000 people in Stone Harbor, New Jersey, in a 5K run, doing basketball, cheerleading, Navy SEALs on the beach, senior citizen activities, different things like that. So just ways to keep active.
Congressman, let me just highlight a program that brings forward an opportunity that we haven't talked about to date, and that's recess. Many schools no longer have recess, and yet that has been identified as the single biggest opportunity for children to have activity during the day. We fund a program called Playworks that brings kids, young people into the playground, helps to teach young children who may not have learned those games that we all learned as children, that not only teaches them how to mediate their differences, but how to have good, unstructured play that we've been talking about. That is a kind of program that starts locally and yet can be taken to scale through the kind of initiatives that you've been talking about.
Sophos?
Yes, Congressman, I wanted to mention that the PE for Life program, which is the physical education component of the Healthy School Partnership, is built on exactly those principles that every child should have the ability to enjoy and engage in physical activity. And they structured it so that children who aren't good at competitive sports, they compete against themselves. They're learning how to improve their own fitness, and then taking that and learning skills that they can then take outside the school and into the family to continue. And we think that that is a key aspect of what we're going to have to do to reach the broader audience of children.
Yes.
Congressman,
I'm just going to ask you guys to wrap it up, though, because we have one more speaker, member, Ms. Schakowsky, and then we have to vote, and we'll be done, so quickly.
There's a whole other category of activities that children need. There's dance class, karate. There's a lot of community activities that they can engage in that aren't team sports, that get them with their peer group. Children love other children, and the way to get children to be active is to get them to be active with other children. So I don't want to forget about all the other activities that can be available.
Thank you.
Thank you. So we'll have Ms. Schakowsky, and then we'll be done. I just want everyone to know, because we're going to have votes, and we really can't come back, and I know you guys can't either.
Okay, Mr. Nowak, I understand that you're head of a CDFI.
Yes.
And although the last few days I've been really working with Treasury to make sure that those get the kinds of funds they need, how are you doing as a CDFI?
How are we doing in general?
Yeah.
Given the economics?
Yeah.
So we're doing well. We've been affected like everybody else, real estate values and the volatility of the real estate market.
I'm concerned that some of the new TARP funds be used for CDFIs, who are really the institutions that are investing in communities, creating jobs and lending money.
I'm with you.
Okay, good. I just want to, we could use your help if you want to call the Secretary of Treasury. Okay. Chicago was mentioned a couple of times. Mr. Jaworski, were you the one that mentioned Chicago? I'm very interested in, and I know you did, talking about what you're funding in well, could I hear what's going on in Chicago? Mr. Jaworski, did you mention?
I did not.
Okay, so the last two. Okay.
There are a number of programs. We're funding a number of programs in Illinois, in Chicago in particular, that are bringing community-based organizations together, stakeholders across sectors, to try to create innovative solutions that build on the assets of the community. So, for example, there's one of the things that they're looking at is how do you get safe routes from...
That's Albany Park Neighborhood Council,
yes,
right? That's right,
exactly.
In my area.
Congresswoman.
Wait, I just want to say one thing about this. I think the issue is, I think you mentioned bringing these things up to scale. There's all these innovative projects all over the country, best practices that have been developed, but then we need to have the resources to make sure that, go ahead.
I think there are three key things there. One is to make sure that there are opportunities for communities that are innovators to learn from one another, so that there are clearinghouses that will allow them to share best practices and information, and then to have innovative funding opportunities at the state and federal level that can take these to scale. And some of the ones that have already been mentioned, like the fresh food financing, started as a local innovation that now brings together public-private financing and is looking to have more federal financing to take that truly to scale. That kind of model, local.
Where is the clearinghouse? Is Robert Wood Johnson a clearinghouse for that, or?
We have a project to actually provide a clearinghouse for our grantees, but that's only one part of it. Clearly, there are many other organizations that are working, and a clearinghouse that includes not only the work we're doing, but beyond that would be very useful in taking this to scale.
Go ahead. You were going to.
Yeah.
GMA was. Yeah,
I was just going to mention that the Healthy Weight Commitment Foundation, which is a private initiative, as part of their commitment of bringing funding for a expansion of the Healthy Schools Partnership to a school in Chicago, including PE for Life, which was referenced earlier as the school program in Naperville, Illinois. So
okay.
And then the nutrition coaches will be sponsored through the ADAF, the American Dietetic Association Foundation.
Is GMA sponsoring some of those ads that are saying don't tax soft drinks and those kinds of things on television?
We have supported the American Beverage Association effort in that regard. We haven't provided financial support.
You know, I mean, I just think that, you know, it's sort of give and take here. That, you know, if we're serious about promoting healthy foods, we have to be serious about it. I saw that General Mills is lowering the amount of sugar in its products. I hope that they find that commercially viable. And I hope that school districts like Chicago will encourage that by purchasing the lower cost, the lower sugar cereals. But, you know, I mean, I understand commercial viability, and Mr. I can't, my eyes are so bad. My CDFI friend said that, you know, we want to make sure that these things also make money. But, you know, it's disappointing to me that you're supporting that effort, because I think we need to be discouraging these high sugar drinks.
I think there's been a tremendous amount of innovation and improvements in the nutrition profiles of products. That's been a focus of our industry, and I think that you'll see that continue. The American Beverage Association has a unique partnership with the Alliance for a Healthier Generation to remove soft drinks from full-strength soft drinks from schools. So I think the industry is doing a great deal to help ensure that healthy products attain a bigger place in consumers' pantries and their daily lives. I think we may agree on the use of disagree on tax policy and whether that works, which we don't think it's an effective strategy. But our industry is committed to provide healthful products and to continuously improve the nutrition profile of our products.
Good. Okay. Well, thank you for that. Yeah, Mr. Nowak. Dr. Nowak.
I just would note that Chicago, as you probably know, and I'm happy to provide the data, has well-documented areas that do not have high-quality fresh food access.
We have food deserts, absolutely.
Number two, there has been, at the state level in Illinois, there has been some interest in replicating the Pennsylvania initiative. I believe a $10 million appropriation was put forward. I do not think there has been a request for proposals issued for that to try to create it, but there has been some movement at the state level in Illinois, and I could get more information.
I'd love that, so we could follow up.
I know we talked to the treasurer of the state several times about it and how to structure it, and there are several organizations, including the Illinois Facility Fund, that I know had some interest.
Which I know well. Great, let's talk more. Thank you so much.
Thank you. We have votes, so we're going to have to end, and I know some of you have to get going too. We can do written questions, though. You may get some written questions from us within the next 10 days, and we appreciate your getting back to us. And we are going to take these ideas and look at possible legislative initiatives. So thank you. And without objection, the hearing of the subcommittee is adjourned.
Great job.
I'd love to learn more about the work we're doing.